Our next physician says being overweight is not just a cosmetic issue. Obesity can put people at risk for other health concerns like strokes, diabetes, heart disease, and even cancer.
Emotions are tied in with eating. I would actually say that eating is an addiction, and people who have never had a weight problem in their lives always say, why don't you just stop eating? But when it's so tied to emotions and it fulfills you somehow, you can't explain it to other people, but when people have gone through it, they understand it.
The nation's scales are steadily rising and the statistics are clear. America has a health crisis on its hands. It's estimated that 1 out of every 3 adults in the United States is considered obese.
Obesity does create other diseases like diabetes, hypertension, sleeping apnea, back pain, knee pain, joint pain. So it causes a lot of other serious problems.
Dr. John Alexander has been specializing in weight loss surgery for nearly 20 years. He offers 3 different types of procedures for his patients.
Gastric bypass, lap band, in-sleep gastrectomy, short-term and long-term safety, they have about the same safety. From a complication point of view, they have very similar complications. They're safe and they give good result.
I had the gastric bypass. The day of my surgery, I was 263 pounds, and I am right now between 130 and 132.
Prior to gastric bypass surgery, I weighed approximately 311 pounds. After gastric bypass surgery, I now weigh about 175.
Before the surgery, I weighed 250 pounds. I was a size 18-20. Now I weigh 127 pounds, and I'm a 0 to 2. I feel great. My body doesn't ache. My knees don't hurt. I have a lot of energy. It's just amazing how much you can accomplish in one day when you do have the energy.
Dr. Alexander says information is key. That's why he offers psychological and nutritional counseling.
We spend a good amount of 45 minutes to 1 hour with each one of these person. We want to make sure that they understand the risk and the benefit of this procedure, because this is a complete life-changing procedure, so they have to be really fully informed.
My life before gastric bypass surgery was empty. My life today is amazing, and I'm so thankful to Dr. Alexander for allowing me to really enjoy my life.
When the weight is gone, the insulin starts to function again, estrogen starts to function again, and that's why these people are so happy. As you see, some of them feel so grateful, not only because how beautiful they look, but how great they feel.
Us deciding to have the surgery was the best decision that we've ever made.
He really is by far the best, and I would recommend him to anybody. If you want to change your life and you're willing to make that change, step up to the plate. Dr. Alexander's the way.